Hey everyone, it is now 12:48 p.m. of the 15th of March, and I have basically reached my limit to what I can do on this day. My brain is like totally becoming foggy, and my joints are also not supporting me right now. So we are doing the previous year questions. We have completed the previous year questions for today, and in terms of the goals that we had decided, we have a backlog of 160 pages from 2 days as of now. We'll try to complete it in 1 to 2 weeks. We have done the previous year questions, we have done GT review, we have started on micro, and I did till page 89 I think of micro, and will probably be able to complete micro today. Will also instead of doing today's portion, do previous day's portion, like surgery 90 to page 130 will be the first priority, and so on, because like that portion, if I do not revise now, I will simply not do it. I have done that thing earlier, that I say that I will revise it later, but I do not do so. So yeah, we are currently on the very last previous year question scheduled for today. Lots of anti-epileptic based questions coming in INI in pharma. So, and I'm not very well versed in that, so I'm gonna buck up on that. Also, when I was doing the GT review for today, I have realized that I have made at least 15 silly mistakes until now. I have done the review until question 180, and so many silly mistakes. My God, like deep sulcus sign, very easy question. Secondary active transport, easy question. Cotrimoxazole, why I thought during the period that we begin it at birth, like when I can actually recall the portion in my notes where it is written as 6 weeks, and yet I marked that. Pap smear, secondary prevention, such an easy question. Syphilis one was I could have done that wrong also. The gram stain portion, that just like this question just tells me that my basics are wrong in that. So at least I am getting some questions that are getting me to strengthen my basics during the GTs. Acute rheumatic fever question also, I marked acute is associated with ASCOV bodies. Like I forgot that for some reason and thought it was associated with chronic disease. Primary angle closure, I do that wrong every single time, and this is what I get from not revising my previous year the previous tests notes that I have made. I will absolutely revise it before giving the next GT. Like however much it may delay the next GT, I will revise the topic and then only give the next GT. Brown sign, this is the second time I have made this wrong somehow. Maturation index, I glossed over it in my notes and thought, yeah, I would know it and everything, but I marked it wrong. Like I marked the pregnant option for the secretary one. I was like, yeah, so intermediate cells should be the highest, so it should be 95, but no, it should have struck my mind that it should not be that high also. Obviously in pregnancy only progesterone should be that high. So yeah, basic mistakes that drove my marks down, and I should focus on improving my basics right now. Okay, it's like almost 1. I'm gonna have my lunch and go to sleep and rest a bit and see what I can do in the evening. Hey everyone, it is now 10:26 p.m. of the 15th of March. I managed to complete the micro portion today, and I did the OMMED portion. I have rubbed it out from 13th backlog. So in terms of backlog, we have 220 pages counting today. Tomorrow, hopefully, I'll be back on track and we'll be able to complete at least 30 pages of backlog every day so that I am able to complete my syllabus. Go back to track by next week, because on the 21st I am supposed to complete this read by like any means possible. And yeah, it's gonna be a very tough task with the recuperation, but we can hopefully do this. And in terms of GT, I am not sure where I am standing on giving the Monday GT. If I am able to complete the review of my previous GT notes, I will probably give the Monday GT. It's time to start a little bit of experimenting, like read the portion that I have set for today, and the revisions I'm gonna stall a little bit and revise them properly, because I keep stalling the GT read every day instead, and it is like 10 GT's worth of notes now, and we have to do at least one read of it and see what comes out of it, so that I can shorten the GT notes each time, and by the end it is just 1 or 2 pages, but that means I have to at least read it once. So yeah, I'm gonna go for it tomorrow, hopefully. And guys, what were your goals for today? Please comment, and how many you could complete. Okay then, bye.